topic I've chosen today is quite important. So the reason behind that is because the chronic kidney disease around the world is growing in number, and the challenge to sort out those people in the current climate, especially in the third or developing countries where the sources is quite scarce, so it's quite difficult and challenging to help those people to get into either dialysis or transplant. And it is the cheapest option, obviously, to transplant a patient rather than going through a renal replacement therapy by other modalities. I'm going to focus on this topic today about donation, actually, transplant donation, kidney transplant donation. A lot of people, I would like to start ayah Qur'aniyya, it's relevant to our topic today. بسم الله الرحمن الرحيم من أجل ذلك كتبنا على بني إسرائيل أنه من قتل نفسا بغير نفس أو فساد في الأرض فكأنما قتل الناس جميعا ومن أحياها فكأنما أحيا الناس جميعا ولقد جاءتهم رسلنا بالبينات ثم إن كثيرا منهم بعد ذلك في الأرض لمسرفون. Obviously, from this verse of Holy Quran, من أحيا طبعا إحياء النفس كأنما أحيا الإنسان الناس جميعا وإعطاء أن تهدي عضو من أعضائك and you gift it to someone else to live on and survive and have a normal lifestyle as you do, as other healthy people do. It's quite life-changing and is very precious gift you could give ever. The content, briefly, the content of today's lecture will be around a case, firstly, very short case, and a brief history about transplantation. Then I will talk about why would you choose a transplant, and what are the short and long-term complications of organ donation, in particular kidney, and what type of living donation are there around. And also I'm going to focus about altruistic donation, which is in Arabic mean الإيثاري التبرع الإيثاري, and some ethics and regulation around the topic. So these two t-shirts are actually, I took this picture for a patient who had a transplant. The next day of the transplant, he printed those t-shirts over the internet. And you can see how the patient very happy and excited about the fact that he has got an organ and he's now away from dialysis. He's very excited to the extent that he's still in hospital. He delivered those t-shirts from over the internet and he wrote this word on this t-shirt: dialysis is a big pain in the, and you complete is the arm. So because people on dialysis, they have pain in their arm every time they go on to dialysis when they needle their fistula. The first short case, this actually 21-year-old male I've just seen this week in Najaf. He's an orphan, lived with his mother only. Around 18 months ago, he lost his kidney function, and they're not quite sure why he lost his kidney function. Presumably some kidney stones and chronic infection, because there was small sized kidney on ultrasound scan. Then his mother was very desperate to get him a transplant because he was struggling on dialysis and he didn't want to carry on doing dialysis. So she actually sold her house, and cost her $70,000 to transplant a kidney in the northern part of Iraq. And she struggled a lot to get that, and it was a type of trade, a transplant, rather than it's actually actual donation. She paid all that money, and we don't know what type of kidney she got actually. So he was told, you need to stay at home. He was literally imprisoned for 6 months. He get depressed and become really agitated. He stopped taking his medication, and after 6 months he went out working as normal life, but he didn't comply with his medication. So he lost his kidney within less than 12 months, maybe 9 months at most. Then he ended up on dialysis again, and now he's struggling on dialysis because of access problem. He's got a line infection, and he got into infective endocarditis. He went into Madinat al-Tib in Baghdad for 10 days. He's got ejection fraction now 39% at age of 21, which means he's got a heart failure and probably valvular disease as well. The nature as of now, I'm not sure about, and I'm following this case to try to help on his route back on transplantation. Now he has got subclavian line, and the line wasn't dressed, and obviously exposed to another infection, and he was actually, his mom, quite keen for him to have another transplant despite all the struggle. And she sold her house, and she living in a rented house. Now this is a question you don't need to answer now, but would you offer this young man another kidney transplant? And if you do, what are the measures you're going to take in order to achieve a better outcome in this case? Just to keep this question in mind for after we finish the slides. Now, a brief history about the kidney transplantation. The first attempt of kidney transplant, obviously it wasn't successful, and it was experimented in 1902. And then the first, well, if you skip all of these, the first successful transplant was in 1959, around 50, early 52, 53. But it was from twins, so you don't need to use immunosuppression, so identical twins, and it was successful transplantation, and this is the surgeon who transplanted the kidney, and he won the Nobel Prize in 1990. The patient who had received the kidney died 8 years later as a result of relapsing original chronic kidney disease, presumably some sort of glomerulonephritis. This is number of transplant undertaken in 2015 in Europe, and you can see in the UK 16 kidney transplant per million population. So it's quite a significant number, and you can see a variety of number going on here and there. And this is obviously only living donor, it's not a deceased donor transplantation. Now, we're going to focus on what are the complications of donation, because people who consider to give a kidney, they have the right to know what sort of complication they're going to face and they are going to expect. What are they going to end up on dialysis, and what time? Are they all going to be in kidney failure and going to be looking at a kidney transplant themselves or not? So the general short-term complication is not much different from any surgery you would go through, as if you go for appendectomy, for example, or other general anesthetic operation. Those are the risk factor. I'm not going to go through them. But the long-term complication, the first and most important is mortality and cardiovascular disease. Now, this is a paper published in New England Journal in 2009, sorry. This one showed that there's no difference between survival between donor and control group. That means general population will have the same risk as a donor in terms of mortality. This after 40 years. As you can see, the two line is actually quite going together. This is a survival curve. Now, this is a study, if you go back. This is a study published in New England Medical Journal, again showing that there is no difference among people who donated their kidney and the general population. This one, death or major cardiovascular event like MI causing death, or major cardiovascular event, death censored. Now, again, another one published in Kidney International in 2014. Now they tried to control the population group, and it did make a little bit of difference. So there is a slight increase in cumulative all-cause mortality in the donation group. So there is some risk, and we need to tell the donor the risk precisely. Now, further studies done about long-term end-stage renal disease in those patient group who give their kidneys. And as you can see here, and it's not quite projecting well, I didn't expect that, sorry about this. So you can see the donor here, live donor, actually at around 15 years, it shows that there is a difference. There is a relative risk of organ donation ending on dialysis, for example. But that risk is not significant when they calculated the absolute risk. And you can see in those graphs also that the different race make a difference as well. More common in black. Black people who donate, they have a higher risk of end-stage renal disease. This one also carried on in the same paper, but again looking at different risk group and different age group. For example, this one is dividing the age group less than 50 and more than 50. They found a little bit of difference. People who are older than 50 carry a higher risk of ending on end-stage renal disease. Now, what about hypertension? It's well known that if you donate a kidney, if you've got a single kidney, you are at risk of high blood pressure in the future. So in this study, which actually is still to be published, it's still on online only, and this was accepted for publication in American Journal of Transplant. This study showed only a third of kidney donor will develop hypertension, and it's not difficult to control hypertension post-donation as you do in general population. But hypertensive donor who develop hypertension, actually they are more prone to have diabetes and proteinuria. So they are at risk of progression of kidney disease at a later stage. As we know that hypertension is a risk for chronic kidney disease. They carry the same risk as they do in general population, the same risk factor. They are not different. When you donate a kidney, you have the same, for example, family history of hypertension. It's a risk factor in the general population, and it will be prone, the donor transplant, to the risk of hypertension. Again, antihypertensive is the same as used in general population. It's better to preserve kidney function. It's ACE inhibitors and ARBs. This is a big study published just in February 2018, a couple of months ago or so, and it is a meta-analysis, analyzed 52 studies, so it's quite a big study, and the evidence from that study is strong enough to convince us what are the risks of organ donation. And the finding was, in shortcut, that its donor had a high diastolic blood pressure only, and we know that systolic blood pressure is much higher indicator of, and risk factor for mortality and end organ damage. So we are more concerned about systolic rather than diastolic. And they did have a poorer renal function, those donor population, and a higher risk of end-stage renal disease. Now you can see that the more they progress the time, they find more risk because they manage to control the population group, which is the control group. And in those cases, actually the relative risk is high, but the absolute risk wasn't significantly high. So it's still, there is some risk. We need to explain the donor, but it is not high enough to stop you from donating your kidney. Female donor actually had a higher risk of pregnancy-related problems like preeclampsia. If a female donates her kidney to her relative or to her husband, we try to make sure that she hasn't got a plan to get pregnant in the future. She has completed her family to avoid pregnancy complication, because it does increase by twofold. So twice higher, which obviously you know the preeclampsia carry morbidity and mortality risk to pregnant patient. Last point is there is no higher risk for all-cause mortality found, or cardiovascular diabetes or cancer in those donating population. So it's quite reassuring, this study, and make it clearer to us. There is an online tool which you can use to assess your risk of end-stage renal disease, and you can just click on those and select what's relevant to you, and you'll get the risk factor. But that risk actually pre-donation. There is a research going on to try to complete this. So you know your risk if you donate a kidney, what would be your risk of getting end-stage renal disease. Now also there is a risk of having gout, because you got single kidney, maybe the clearance of uric acid getting much less, and there is a clear risk of increasing possibility of having gout and ending up on some medication for that. So what are the type of allowed or permitted living donation? There is a direct donation, which is maybe a relative or genetic relationship between the two, or a friend. But what is not allowed is to sell your kidney, is because there is ethical problem behind that, which I'm going to talk about. Paired or pool donation. Paired mean you got two people, and two pairs. Two donors and two recipients. Each one wanted to give to his relative, but is not actually a good match. So what they can do, they can exchange it. I give your kidney to your husband, and you give it to my wife, for example. This is the deal between two families. The other one is non-directed altruistic donation, which is very exciting topic, and it's growing. It started in 2007. Altruistic means you give your kidney and you don't know who you give it to. You want to give something extra you have. You wanted to give someone needed. in need. So this is translation called إيثاري, the التبرع الإيثاري. إنسان يؤثر على نفسه فيعطي ما هو فائض عن حاجته ولو هو كان محتاج. This type of donation in UK, there is now 600 type, almost 600 donations so far. All of them are white, although as you know, UK is multi-ethnicity. They have ethnic minority, they have black, they have Asian, but most of the donors in the UK are white. And white kidney from a white man or a white woman work well with a white woman or a man. It doesn't work well with Asian because of genetic and HLA typing. But the problem is we don't have enough donor to give people in need from the same race. So this type of donation, I came to know about it actually only last year. It struck me and shocked me that how people can be really very generous to give their kidney to someone who is a stranger they don't know anything about, and no matter what religion they belong to or what ethnicity. And there is another type actually, is direct altruistic donation. So you can choose who to give, but not based on race or religion. You can choose to give your kidney, for example, for someone who is genetically related to you, but you never met for a long time, but you say, he's my cousin, live in America, I haven't seen him for 40 years, I haven't had any contact, but I would like to give him my kidney. This type of kidney is allowed. And this is an example of paired exchange. You can see two donor and two recipient exchange their kidney, and can be even done on 3 pairs, which called pooled donation. That means you put the kidneys in a pool, literally, and you pick and choose which one is more suitable to which. Now, this is altruistic kidney donation, and this is an example how an altruistic kidney, someone who got a kidney, I want to give it to the most suitable person. What they did in this case. So this is altruistic donor, give his kidney, and we have 1, 2, 3, 4, 5 pair of donor and recipient. They are not matching, not a good match. So what this altruistic donor did, he matched well to the first recipient. Then when we found that kidney, this chain worked well to carry on the rest of the transplant, because he solved the problem. If you remember some story about Imam Ali, when he had to divide camels, and he added 1 camel to the group to solve the calculation. It's kind of similar type of things. Here, they give the kidney and solve the chain, and what ended up the chain, ended up someone waiting without a donor had a kidney. So this one actually literally gone to this one, but in an indirect way, and solved the problem to 5 other people. So imagine, this is هذا ما هو يعني what I meant by آية كريمة أحيا الناس جميعا. He gave 1 kidney when he's still alive. أحيا الناس جميعا. This group is more than 3, and جامعة, we know in Arabic, is more than 3. And this is an example of such donation. Now, this is a growing number. I talked about altruistic kidney donation. It started around late 2007, and the number was only 15. And now, you can see in 2014, we had 118 altruistic donation. People came forward to give their kidney for a stranger. And last year, it was only 85. But still, people coming forward, and education is an important aspect in that, to help people awareness. I need to be aware of time. Can you tell me what time? Exchange program. This is another example. How could pair 2-way exchange, 3-way exchange, And also, as I spoke earlier, short and long altruistic donation. This is the matching process. It's computerized. They put the donor and recipient detail, and the computer does the rest. So you don't need to be worried about, you don't have to do it by your head. So what are the contraindications for transplantation? The Organ Procurement and Transplant Network set up a criteria and a contraindication for transplantation. Need to be aware of, there are other contraindications which are medical ones, and the transplant team should be addressing those issues and excluding those patients who are at risk. You don't want to cause harm, because doctor meant to be, don't cause harm, whatever you offer, unless the benefit is higher than the harm you're causing. So, for example, age less than 18, you can't take a kidney out from because of consent issue. The under 18, they won't be able to give a valid consent. So it's prohibited, it's not allowed, and if it does happen, need a court order to approve that type of transplantation. Also, uncontrolled hypertension and impaired kidney function, you can't do that. Even if they come forward to you, transplant, and they say, Father, for example, I want to give my kidney to my son, but he's got a kidney problem already. You can't take it because you're going to cause harm. Going to cause harm to the father. And as I said, we meant be not to do. HIV infection is a contraindication, but it's not an absolute. There are cases by cases they have successfully transplanted. So the donor could have HIV, but they still can't use their kidney. But very, very set criteria, and they do it only in a specialized center. Type 2 diabetes or any type of diabetes is a contraindication. Active cancer or partially treated, evidence of acute symptomatic infection, people with sepsis or so on and so on. If you've got active infection going on, you can't give your kidney. High suspicion of illegal financial exchanges. For example, I give you my kidney, you give me your house. This is illegal in Western country, and they should have, each country have legislation about that. I'm going to talk briefly about Iranian experience about this financial thing. Poorly controlled psychiatric disorder, people with poorly controlled schizophrenia, they are not suitable for transplantation, primarily because of compliance with medication. They're going to lose the kidney straight away, so there's no point. These are some of the evaluation and tests you undertake before transplantation on a donor. And the exclusion. Obviously here, ABO incompatible, no, not anymore the case. Nowadays they do, even blood group is different, still you can't take the kidney of your wife or husband to wife, and going well, I've seen cases, but there is a risk of, a lot of risk of failure, of graft failure, and the preparation for that procedure very costly, and you need a lot of immunosuppression, risk of infection higher, and risk of failure as well. So it's not absolute contraindication, but as you can see, there's extensive tests you need to do before you're going ahead with a kidney transplantation. For the time's sake, I'm not going to go through that. This is the BTS guidelines for living donor kidney transplant, and is reviewed very regularly, and this is the 4th edition and the latest one. And I highlighted some ethical issue from this guideline. So I mentioned earlier that we need to assess and explain to the donor all psychological, social, and financial impact of giving their kidney. They need to know that when they have the assessment, they might find the health issue can affect their health insurance, for example. These all information need to be relayed to the subject who is coming forward for donation. So assessment of donation and subsequent renal function and psychological impact is important, and also suitability of the donor in terms of anatomy and transmissible disease. It could potentially, for example, CMV, you need to test CMV virus, you need to EBV. Obviously it's not a contraindication, but you need to assess and put into account. The Human Tissue Act is the one who does regulate and control the donation itself, and it does keep changing and updated every now and again, and it is very important to have such legislation in a donation program in any country. And it is an offense in other country, in Western country, it is an offense to give or offer or receive any type of reward for organ or part of an organ, even a part of liver. If you donate and get some money, it's not allowed, and it's an offense, and it's carry legal consequence. Reimbursement, so they are all expenses of organ donation will be covered by the government who's run the organ donation program, and obviously further follow-up will be sponsored as well. Adult without mental capacity, they need court approval. People who doesn't have capacity, for example, they have a mental health issue, they can't donate. There is independent living donor advocates. This independent person assesses the donor separate from the recipient. So if you are a transplant surgeon or a transplant nephrologist assessing the recipient, you're not allowed to assess the donor because you will be biased. You will be biased by the fact that you want to carry on the transplant. So there is an independent person should carry the assessment. There are issues around consenting. Now, the main thing I would highlight here is if identical twins, one would like to donate a kidney to the other, one developed renal failure and the other one still got two kidneys that's working perfectly fine. And actually the outcome of that transplant is perfect because you don't need any immunosuppression. They just match each other, so the outcome is excellent. Would you carry on that? There is an ethical issue. Some say, yes, go ahead, because even though they are children, the psychological impact of his brother being well as he is quite good, we should carry on. Others said no, because they don't have the ability to consent and you can't go ahead with such operation. So there are ongoing issue with the organ donation. Now, before I go to the conclusion, the Iranian government set up a program, a donation program, and kidney transplant in particular, and they offer the donor some amount of money. It's around $9,000 in order to give the kidney, but this paid by the government, and the arrangement between the recipient and donation only does happen through the government. So they control it, and also they cover health insurance for the recipient, for the donor, for a year at least post-transplant, and there is some help. So now, what's the outcome of that is the Iranian don't have a waiting list. There's no more waiting list. All people who are waiting for a kidney, they have the kidney. Now, what is the ethical issue behind that? What's problem behind it? The world looking at this experiment is quite very fascinating and looks good because the outcome looks fine. They don't have waiting list. But the problem they're facing, they say, 2 points here. One is the kidney you're receiving is from a person who is desperate to give a kidney, so they may hide some information about their health, other problems, so you're going to end up with a kidney probably not quite good. So you're going to harm the recipient as well. And the other point is you are using people who are in need. They are needy people, they are poor, they are looking for those $9,000 to help in their life. So you are using their body to survive on. In conclusion, we come to know that altruistic kidney donation can make a huge difference and can make 6 people in a chain to get a transplant. And kidney donation is safe when careful evaluation undertaken, and also ethic and regulation is quite important to be set and used to guide organ donation. And thank you very much for listening, and I'm ready for a question, please. Thank you. Otherwise, you will lose control. And if you lose control, not only trafficking as a matter of financial impact, but actually it's going to carry a poor outcome, because donation not going to be controlled. This woman I earlier spoke about, the case, the 21-year-old, his mother traveled 3 days in the forest to meet those trafficking people. And she changed her face by washing with, washing liquid to make herself older. She was walking, bending her back. So it's a very tragic story. And she went through that just to get a kidney to her son. And she spent all that money. So we shouldn't allow such case to happen as a society. On top of that, obviously, government need to have a good role on that and stop such act. Thank you. Thank you.
Any more questions, please? Dr. Ammar, about altruistic donation, who will organize this? Is it the system within the government hospitals, or there's a special society in UK who organize the altruistic donation?
So each area, obviously, they have a transplant team, living donor and deceased donor team. So there is a coordinator. They have a contact number on a website. They can easily approach, and they can arrange a meeting. Any person who want to come forward and donate their kidney. So they meet, and as I said, those who's dealing with the donation, they don't deal with the transplantation process itself. So they are independent, and they go through the process, talking to them why you want to. You don't have to have a particular reason if you are altruistic. You can just want to donate a kidney, and they go through the risk, what they're understanding behind. So each center have their dedicated coordinator for living transplant, and that's the person who they get in touch with. And then they see a specialist, and they go through the surgery itself, nephrectomy, whether it's going to be laparoscopic or open. Most of these days they do it laparoscopically.
Any more questions? Okay, thank you very much, Dr. Ammar.
Thank you.